prepping for a world first. And in this hospital theatre, it's not just the medical equipment that needs to be working perfectly. It's from here that a major surgery will be broadcast as it happens around the globe. And the 62-year-old patient who's agreed to have his cancer op watched by thousands seemed remarkably calm. Do you feel funny at all about people watching you on the operating table?
No. If I did, I would not have asked you to do this Flemings.
Soon after, anaesthetised, he was brought in for what in surgery terms was a common enough operation, but there was nothing routine about what was to happen in the hours ahead at the Royal London Hospital.
OK, we're live.
And he was,
yes.
Talking to viewers on a feed from the theatre.
So surgery's about teamwork.
Courtesy of some very powerful lenses. Of course, operations have been filmed and watched before. The difference here is the technology. That 360-degree camera over the operating table, which is now streaming live, allowing viewers to zoom in and out of any part of the theatre. The surgeon's even happy to take questions. And in a different kind of theatre nearby, medical students were using their smartphones, headsets and screens to get a view on surgery they hadn't seen before, able to focus where they wanted.
I found it really great because I've been in theatres before and it's often really difficult to have a good view of what's going on. So often you're pushed to the background and you can't see anything.
It would give you the opportunity, if you could see different types of operations that maybe you wouldn't be able to see otherwise, or maybe rarer operations as well that don't happen as often.
You'd be able to see going in into the abdominal cavity.
But for the surgeon at the heart of this initiative, the most exciting news was that medical students from as far afield as Bangladesh were watching, listening and learning. He believes that virtual reality could transform training for doctors in the developing world.
If you want to train at the moment, you might have to move countries, it might be difficult to move. It costs money, it costs resource. And actually, do we need to move people away? Why not actually transport them in virtual reality to another part of the world, like New York, for example, Harvard or Rome or London? We've got good surgeons. They learn great quality of care and maybe improve their standards. And maybe we can learn from them as well. I think it works both ways, actually.
The team behind what's being called VR in the OR intend to keep pushing technological boundaries.
We finished the operation. It's been a success.
But there's relief the patient who featured in their first live stream op is doing well. And believe it or not, he's planning to watch a recording of his surgery as soon as he's able. Michelle Clifford, Sky News, at the Royal London Hospital.